Hey everybody, it's Kristen. I wanted to make a short video walking you through the contents of the redeployed nurse packet, or actually care team packet is what we're calling it. We're going to be receiving staff that are redeployed from other areas of our organization soon. And so as they come into the critical care arena, I wanted to give you some information about what will be in their packet so that you know what they have access to and reference to, and which things they need to complete. So this packet actually looks a lot like a normal onboarding packet. It's got two sides. I'm gonna have to take away my little background here, but essentially two sides. This side is the short little side of things that have to be completed, filled out, and they have to come back to me. And then this side is the reference section. So I wanna go through it. So right here, we got the table of contents, and this will walk them through everything that's in the packet. So this section 1 is the short stuff that has to come back to me, please. And then all the reference stuff is here. And there's also a little bit of a process piece so that you know in critical care what things do they need to complete and which things have they already completed in the general redeployment orientation before they came here. So that's right off the top on the left side. There's an on-unit skills validation that needs to be completed and returned to me as a validator. Preceptors, please fill out this backside here as you validate skills. There's going to be a preceptor, it's an orientee evaluation, but preceptors, you complete this. So this looks a lot like the normal form for anyone that is onboarding to our arena. And this has been modified for redeployed staff. So it's just meant to be a little bit of a cognitive aid for you as a preceptor to make sure that you cover all these things. And then to tell me how they're doing as a redeployed staff member that's coming here. Are they progressing? Did we not observe that skill or task? Did we give training, or are they not progressing? So these are your 4 categories to rate on each of these skills. Backside looks very familiar: goals, comments, and then a place for you to sign. We want all of the redeployed staff to complete 2 precepted shifts. So there's 2 of these forms. That's a minimum of 2 precepted shifts, just so they have a really initial onboarding experience with what is the workflow, where are the resources, how do I communicate, who are the people in my team. I did create a little passport here for redeployed staff. So charge nurses, preceptors, this really is to help you as much as it is to help the redeployed staff. So it's going to be a little bit about the person. Where do they work normally? What's their background, strengths, weaknesses? What do they like to do? This is general onboarding stuff that should have been completed by the time they come to you. If some of this is missing, it's helpful for you to know, oh, they don't have Pyxis access, or they don't have glucometer. So that's going to be checked off by the redeployed staff member as they complete these things, just so they know and we know where they are in the process and how we can best help them onboard to the critical care arena. Okay, so the passport. I would like that back. So that's in the section 1 of things that come back to me. And then I just included the glucometer access piece for anyone that doesn't have glucometer access. Okay, second side of the onboarding packet is reference material. There's a good little chunk of it here. So I just want to go through it with you. The first section is actually going to be the redeployed, can't see it. There we go. The redeployed care team roles. Okay, so you can see the green is our team lead, the red is our care team 1, purple care team 2, and then orange is going to be for core ready staff. And I'll talk about what this means in just a little bit. All of the redeployed staff are getting the same information that you got from me about team nursing model. So normally we function in primary nursing care delivery, and that's just the way that we're trained, and we deliver great care in that way. In preparing for patient surge, we need to think differently about how we utilize all of the available folks that are going to be redeployed to us. How can we deliver the same high quality care just in a different way? And so that's where team nursing comes into play. And a big part of our care delivery is going to be upholding our current standards of care. So I did include in their packet the standards of care for critical care and PCU, ICU, PCU. They're all here because we need to uphold the normal standards of care until we're told otherwise by the government, by the state and local government, saying that if we reach capacity for emergency standards of care, that would be a different standard of care. But until that point, we operate into a normal standards of care. And so that means documenting the care that we deliver under our normal standards of care. So you guys see this document around the arena, but it's reminders on what is required documentation per the standards of care. This first page has organized information by flow sheet, and the second page has organized information by time. So if you think in terms of flow sheet, come here. If you think in terms of the time, go to the second page, but all of those are reminders of what is required documentation in our current standards of care. Okay, so for staff that are redeploying, they might need to set up their KP Health Connect to allow them to document for inpatient RNs. If they're from an ambulatory surgery center, they don't see the normal patient list that you and I see. So they need to be able to set up their KP Health Connect. And this document is going to tell them how to do that. Also, as a preceptor, I know you're going to be narrating a lot of your care and your workflow out loud. I don't want you to have to say too much out loud because you're going to lose your voice from talking so much. But this document is meant to help guide that redeployed staff member to My Help, where there are many learning resources available on how to document a shift assessment, how to document an admission, how to document a discharge, a vaccine. All those things are right here. So this is a step 1, 2, 3 that's going to show them how to get to My Help for all those learning resources. Okay, Vocera. I don't think I need to say anything more about that. We communicate a lot with Vocera. This little quick sheet is for critical care. So how do they reach the respiratory therapist, the charge nurse? This is critical care specific Vocera tips. I did include also how to arrange transport for a patient. And then for those that are going to be working on nights, this is a how to communicate and reach people at night. And thanks to Allie Martin for creating this. It's a very helpful tool. Also included is 24-hour workflow for each of our units in the arena. So everybody has 24 hours of what can I expect? If I'm redeployed to MSPCU, what can I expect at every hour of the 24-hour clock here in MSPCU? So this is all included there. No matter which unit that they are orienting on, there is a 24-hour clock if they need it. Stroke care resources are available here on Stroke Central, so I just want to point them to where the most current up-to-date resources are, as most of you know. I also wanted to include just some awareness about the functionality for Braun infusion pumps that we're all working through right now. So KVO mode, be aware of that, and be aware of the air bubble with the prime. So we want to just keep people safe, make them aware of issues that we're working through. For Code Blue, this is a nice piece of video and resource process updates from Chris Cox and Becky Campbell. So thanks you guys for that. Really great stuff here on Code Blue. They also have a little sample CPR record and debrief form. Remember, we really want the good debrief nuggets from our Code Blues. Okay, MTP, should we? Never need it, but it's here in case we do. Information about the process, supplies, changes per COVID. Open chess code, roles, responsibilities. Again, hopefully they never need any of these documents, but they are there just in case. Okay, I want to switch real quick to share my screen and run through the team nursing model. Okay, so you guys, we have seen some of this stuff before, but I want to go through it with you. So what is team nursing? You know, we've been talking about how primary nursing is the way that we've been delivering care for a long time. With preparation for COVID patients and patient surge, it's really challenging us to think differently about how we can still deliver that high quality care with different resources. So the objectives of team nursing is to just describe those differences of primary and team, to clarify the roles that are in the team nursing model and the expectations for each of those care team members. So like I said, primary nursing is what we've been operating under currently. So there's one nurse to their assignment, and that's the way that we're used to delivering nursing care, and you guys do a phenomenal job. So this is not broke. We're not trying to fix it. We're just trying to adapt with preparation for patient surge. Team nursing is going to use a group of people to deliver that same high quality care. But essentially, if you're that primary nurse and you step into what we're calling the team lead role, that care team leader, you're still wanting to use all the foresight and judgment and critical thinking that you would normally in your primary nursing model, but you're now doing it through the delivery of other hands that are delivering that care, helping turn, reposition, feed, ambulate, and provide all the elements of patient care. Okay, so what does this look like? We want to be really clear about how we see this model working here in the critical care arena here at Sunnyside. We have a leader that's going to delegate those appropriate responsibilities based on what people have been trained to and what's the scope of their license. Also, clear communication. This cannot be emphasized enough. Closed loop communication, clear communication as best as you can, and to make a really safe space for people to speak up and say, can you show me how to do that? I've never done that. I don't feel comfortable doing that. We're going to need to be flexible and adapt to the challenges as they present themselves. We will try and prepare you as best we can and share information and key learnings as they come in. But flexibility is going to be one of those key skills along with communication. And so many of you do this really well. So I know that this is going to be something that is going to stretch and challenge us all, but I know that we're also going to rise to the occasion and do a great job. Okay, so in the model, I held up this paper, but this is easier for you to see that you see here in the green, we've got our care team leader. So if you're an ICU, PCU, med-surg core staff member, this would probably be your role in the team nursing model. And so you're going to see the roles and tasks here. These are the things that you're going to be focusing on. So documenting the care that's provided by your team, leading and directing the care for that team, whether that's physical assessments and medications, delegating or communicating these duties and tasks to your care team 1 and care team 2 members, and upholding the standards of care for our unit until those standards change. So currently we are in normal standards of care, and we're going to keep in that space until otherwise notified. But specifically here on the right, you see for critical care, ICU arenas, that will also mean assessing the hemodynamics and the level of sedation. So, you know, as a core team member, you're used to using your assessment skills to gather information and think critically and assess and synthesize. And so those thinking skills cannot be readily translated to care team members that are there to help deliver the care, but you still have to think through the assessment pieces. So as the team leader, you know, you're walking up and down the space where your patients are at, you're visually laying eyes on them, you're looking at their monitor, looking at your patient, you're assessing their hemodynamics, level of sedation, giving instructions to titrate medications to your care team as you feel. You would be the one pushing those buttons. You're going to also either do it yourself or ask your care team members to do that, and managing those invasive lines. For Care Team 1 nurses, this is going to be a nurse who's redeployed from another area of our organization. They are not going to be from the normal core of that unit. And then their roles and tasks are defined here, specifically in right. On the right side of the columns, you see the additional clarification for critical care. So these folks can help you with trach care, suctioning, applying BiPAP, taking it off, as well as the other regular parts of nursing care delivery. So basic hygiene and feeding, ambulation, assessments, whether it's a full body assessment or a focused reassessment, you know, as nurses, we can do those things. And so those team members are going to receive training on how to do that proficiently here in critical care. And as the team leader, you're going to be helping assign those tasks and keep the day focused and on track so that we continue to uphold the standards of care. For Care Team 2, this is specific. It says staff because it may not be a nurse. So this is going to be a licensed or certified person, a CNA, LPN, MA, dental hygienist. It could be a nurse, but it's going to be someone who you would really utilize to deliver more of the basics of nursing care. So, you know, hygiene, feeding, ambulation, again, document the care as they give it, that's highly encouraged. And then just communicating back to the team leader so that we keep the patient care priorities that are true priorities at in focus. Okay, this orange category is someone who is a redeployed core ready nurse. So this is a little bit different than what you had seen in the past with our care team model. This role was created recently to allow for primary nursing model to continue for nurses that are maybe new to a core team, or for nurses that cross-trained to a core team and pick up shifts here and there, but they may not be ready to step into that nurse leader role. So this is someone who is core ready. They can take a primary assignment that you would normally give in that care area, but they won't be leading a team. So they're still going to be operating in primary nursing model. Okay, so we talked about all three of those. I want to break it down so that we focus on them one at a time. So the green, like I said, nurse care team leader. So licensed RN, you are a core team member, and in the team nursing model, we're just going to have you, function a little bit differently, leading a group of people that are care team 1, care team 2 to complete the care and tasks and assignments that you normally deliver in a primary model, but they're going to be your hands to deliver some of the care as you direct them to. So primary nursing model is going to be shifting to care team leader for most of you. Again, there's that caveat call out for who should not be a care team leader. You know, if you're a brand new employee, you're a new team member, a new intern, you're an on-call staff, or a few other things that would just, say, hey, I'm not quite ready for that leadership role. We have that core ready role for you. Your shift duties as a team leader, you're going to get report just as you normally do. And then you're going to think about how to deliver the care that needs to be accomplished over that next 4 hours, 8 hours, 12-hour shift, how to do that with your team. So you want to know your team. You want to know about their strengths, their weaknesses. You want to communicate well with them, know their names, know their skill level, and then start assigning out things to do. So if I'm stepping into that care team leader role and I'm working with a team, I would use closed loop communication, much as we're used to using in ACLS, where I would say, hey, let's go ahead and do these tasks. I would use names. Let's do these tasks for these patients. Will you please do this task and report back to me when it's done? Or, hey, for the next 2 hours, these are the priorities of our care. Will you start over here? Will you start over here? Do these things. Let's meet in the middle. Report back to me when it's done. The closed loop communication is very important. Okay, so the report back to me when it's done, or let me know when that's completed. Whatever the words are that you say to make sure that they're reporting back is very important, so that you can confirm these things have been completed, this care has been delivered, and now we're ready to move on to the next priority. All right, expectations for each of the roles are laid out. So continuing as you normally do, core team staff, you're gonna be identifying the patient care priorities, working with that team of staff to keep everybody safe, everybody operating within their competency level, but to deliver the care. Again, the closed loop communication, super important. And then just as the leader, you're continuing to evaluate what is the priority in the moment. So just as you do, as you're taking care of your assignment of patients, you're constantly reevaluating what is the priority of care. And that's what you would continue to do, but within that team model for delivering the care. All right, I'm going to zip on over here. Oh, here's the highlight for our green nurse care team leader. So just to call it out, there you have it. There's the role, there's the expectations there, and specific pieces for critical care. All right, so for the red care team 1 nurse, so you are a licensed nurse and you've completed the care team 1 competencies. You're someone who's been redeployed and precepted and onboarded to the critical care arena. And you're going to have this red care team 1 nurse designation. Okay. You're going to be getting report from the offgoing nurse care team and participating in that care team huddle where you talk about what are the priorities for that period of time or for the day. You're going to be communicating to your team leader. You're going to be doing things that include a physical assessment, vital signs, giving medications, which would include continuous infusions, managing and supporting airways, suctioning patients, documenting eyes and nose, helping with peripheral IV access, managing feedings, and performing skin and hygiene interventions. And you would document the care that you provide. You're going to be receiving task assignments from the care team leader. Use closed loop communication. You're going to perform those RN specific tasks, and you're going to alert the care team leader of any concerning physical findings, and you're going to complete the tasks as assigned. Okay, considerations. Got a few things here. As a care team 1 nurse, you're not independently caring for an assignment. You're working within a team, and you're communicating concerns and information back to that team leader. This is your section of that category table there. Highlight the role. All right, care team 2 staff. So your licensed or certified staff, CNAs, LPNs, MAs, dental hygienists, you've been redeployed to critical care. You're going to be working also within the team. And your shift duties will be, again, to participate in that group report, communicate in the huddle about what the priorities are and who's the patient population that you're going to be helping with. You can do things specific to, feeding, taking blood sugars, documenting eyes and nose, turning and repositioning, providing line care, hygiene care, assisting with transports. Certainly everyone will be responsible for helping manage call lights and alarms, whether it's a bed alarm, chair alarm, VSA alarm, and documenting the care that you provide. For our COVID areas, you also could be helping with what we call a DON-DOF role or a COVID resource role. So this is something as a care team 2 member, you might be assigned to help with, and more information will be provided for that. Cleaning workstations and surfaces throughout the unit, restocking carts, getting rooms ready for admission, or maybe stripping linens and taking things down after a patient discharges. All of these skills, whether you're care team 1 or 2, will be reviewed in your precepted shifts. You're going to be, again, using that team huddle time closed loop communication to perform those specific tasks and documenting the care that you provide. So you're not independently taking a group of patients as your assignment. You're working within this team and under the direction of your team leader to help deliver the care for a group of patients. And this is your section. Called out for your role clarification and for your tasks. Okay, so for staff that are core ready, this could be someone who is a core staff member that's just new to the team, or you could be someone who is a cross-trained staff, but essentially you're a nurse that has the safe skills and competency and training to provide normal primary nursing care as a core staff would. And so these will be your responsibilities. You're going to continue in that primary nursing model the way you currently do. Receiving report, performing all of the nursing care and documentation, and then giving report to another core ready nurse. And there's not much to update about this. It's a role that you're already used to. Okay. The one call out here for the orange core ready nurse is that you're not a nurse care team lead. Now, if this is a role that you're in and you want to progress to the care team leader, that can certainly be something that we train you to. But you're going to be providing that normal primary nursing care and not leading a team for whatever reason. And so this is your call out on the category table. Okay, so in summary, I know there's some new concepts here, but we're going to keep working together through this as we go through it and providing excellent care, communicating, and just being flexible and adaptable is really what's going to carry us through. And you guys already model so many of those skills. So I welcome your feedback and your questions as we work through it. And I know we're going to continue to deliver great patient care as a team So thanks for everything you do, and thanks for your attention on this video, and I'll see you soon.